Okay, good morning. I hope you can hear me all right. I'll play this back just to make sure. This is Professor Sokol. Happy St. Patrick's Day. I'm not wearing any green because I don't really have any green. We're going to talk about how to measure wounds, and during the presentation part of the WebEx, I'll go over more information. But I have Seymour here. Seymour's helping me today, and I'm going to point out his different types of wounds, and then I'm going to show you how we would measure them. Okay, when we're talking about wounds, there are 4 different stages, and then there's 2 other categories we can give to wounds. This one right here, which just looks like a reddened area, it's not broken open at all, that would be the stage 1 wound, and we'll talk more about that and give the description to it. This is a stage 2. Stage 2s, if you want to think about what they look like, are a blistery type of wound. It's very shallow. Sometimes they're open, sometimes they're not, but it is just the dermal tissue that has broken through, and hopefully we can successfully heal that before it gets to look like something like this here. This is a stage 3 wound. It's a deeper wound. That white area in there, that is called slough, and that is something that has to be removed when you're taking care of a wound. Otherwise, the tissue underneath it can't heal. I'm going to X that off here for a second. Sorry about that. Okay, this is the stage 3. We're still not so deep that we can see ligaments and tendons or bone, but we do see subcutaneous tissue and fat. This one here has a tunnel in it, and I will point the tunneling and undermining out to you when I do the measurements. This is the stage 4. This is the deepest stage wound. This is a full thickness wound, and this is also full thickness. The 1s and the 2s are partial thickness. The full thickness wound, as you can see, we do see bone. If you were able to see, I can zoom in there, you can see muscle tissue. There's a lot of slough. This is called eschar. It's like scabbing, and you have to get rid of that when you're doing your wound dressings, or the wound isn't going to heal. Now we have 2 other classifications. One is unstageable, and this is considered an unstageable wound here. We have slough over about half of it or a third of it. We have eschar over a third of it, and there's only 1/3 of it visible. If we don't clean that away, we can't tell what's underneath it, and you can't really stage it until you get rid of that excess tissue. And then finally around here, this one here is called a deep tissue injury, and it looks like a purple or a deep red blister, almost like a blood blister. These also have to be usually opened up because you have to make sure you see what's under this. I had a patient one time that had one of these on his thigh, and after the doctor had debrided and opened that up, I could stick my hand in halfway up to my elbow. So it was very deep. Let me get rid of these things here. I have to log out of this. Okay, so let's talk about measuring wounds. There's 2 types of things. There's the clear acetate measuring device, and I don't know if you can see that here. I guess it was better this way. Okay, it's better this way so you can see it. A wound measuring device. This would be for circular wounds, oval wounds, and it can't go outside of the exterior area. I'm going to use this on the 3rd stage 3 wound, so you can see what I'm talking about. You would lay this over the center of your wound, and because we don't reuse these in actual practice, you can take a magic marker or some kind of an indelible pen and draw around the wound, and then you take this off and you can make your measurements, and it's in centimeters and millimeters. Okay, you can also use this little ruler type thing if you wanted to measure this way. Okay, now there's another way that we can measure, and I'm going to use this for Seymour's large wound. because I'll show you in a minute. I'll show you that this circular thing wouldn't work. His wound, first of all, it's not circular. It goes outside of the margins, and so you couldn't use this on a wound this large. For something like this, I'll pull him in closer, we would want to use a tape measure, and we're going to measure from the, for the length, our book has us measure proximal to distal, so that's what we're going to measure. So we would measure from the top of the wound, get my finger out of the way there, the top of the wound to the bottom of the longest axis. Let me fix that here. Okay. And that would be our length, whatever that would say. And then our book tells us to measure across the widest width of it. So I can do it like that, and that would be the width. I have worked in facilities that want you to measure the longest axis, no matter where it is. In that case, the longest axis would measure this area here. But the book says proximal to distal and side to side, so that's how we're going to measure that. Next, I'm going to take a Q-tip, and I'm going to open it up because I need to measure the depth of the wound. Okay. So, of course, I'd have gloves on. I don't have any gloves with me, but you'd have gloves on. So to measure the depth of this wound, I'm going to go probe it, and wherever I find what I consider the deepest part, I'm going to let my hand rest on the edge and hold it up like that. Let's see, can you see that? Yeah, like that. And then I would measure this way. I would measure the length of that. Now this wound has something called undermining. I don't know if you can see that. It goes up under here. It's like a lip. So I'd have to measure the undermining, and I'd have to probe all the way around like this. And I'd go to the deepest part, slide my finger up, and I'd measure that. So I'm going to measure, let me see, like that, actually, so you can see what I'm doing here, like this. Okay. And it would be wherever that ended up. I'm using millimeters. Now this also has something called a tunnel. I probed around the wound, and when I got over here, oh, slides down in there. So that's called a tunnel or a sinus. I would pull that out, and that's pretty deep. Where is it? You can see how deep that is. And then you would measure that the same way. You would measure the length of that, okay? And save your questions, because when we get back to the live presentation, I can answer your questions. You want to always describe the interior of your wound. This wound is red and moist. There is slough noted at the top about a quarter of the way down, and at the bottom. There is eschar noted. You can measure the amount of eschar, or you can say where it is. When we describe where something is, we use like a clock. This is 12 o'clock here. This is 6, 3, and 9. So that would be at about 4 o'clock. So there's eschar at 4 o'clock. Same way when we're describing our undermining and a tunnel. You would start where the undermining is, which is, that's actually about 11 o'clock. Well, I'm going to say for you, it would be 2. For you, that would be about 10. 10 to 2. Okay, that's what we're looking at. From 10 o'clock to 2 o'clock on the wound is undermining. And then we'd say what the depth was. For the sinus tract, which is over here, that's at about 4 o'clock. So we would say there's a sinus tract at 4 o'clock, and then you'd give whatever the measurement is. Okay, so there is no maceration, which means the surrounding tissue is intact. I don't think I have maceration on this one. No, I have a slide that has maceration on it. So the surrounding tissue is intact. So I'm going to describe this wound. It's a stage 4 full thickness wound. There is bone visible Subcutaneous muscle, there's fat. It's covered with slough about 1/4 of the way down, and also at about 4 o'clock. There's also eschar at 4 o'clock. Actually, that's 7 o'clock for you, but at 7 o'clock. There's undermining from 10 to 2, and the depth is whatever I got, millimeters. And there is a tunnel over here at 4 o'clock, and the depth is this. The surrounding tissue is intact.